This is a See Jason podcast, and I'm Dr. Anna Zisman from the University of Chicago. I am honored to discuss our work evaluating racial differences in risk factors for kidney stone formation. Kidney stone incidence and prevalence are rising in all racial groups, but the fastest growing group of stone formers in the United States is Blacks. It is not well understood why this is the case, and understanding whether there are differences in how kidney stones form between groups may shed light on these disparities. In our work, we looked through the records of Black kidney stone formers in our program over the last 10 years. We noted 117 Black stone formers who had complete 24-hour urine collections and clinical evaluations in our database, and matched those stone formers by age to 172 white patients with complete records. What we found is that Blacks had lower 24-hour urine volumes than whites, 1.4 liters versus 2.0 liters. Not only was the total volume lower, but also the electrolyte-free water excretion was significantly lower, 207 versus 435 milliliters per day. The calcium excretion was also lower in Blacks, 116 versus 217 milligrams per day. Since all stone formers in our program receive standardized treatment recommendations to increase fluid intake to at least 3 liters per day, as well as to limit dietary sodium intake to less than 2,300 milligrams per day, in addition to more personalized therapies, we wanted to compare treatment responses between racial groups. What we found in the subgroup of 77 Black and 107 white stone formers who completed follow-up collections is that both groups increased their urine volume similarly, by approximately 1/2 liter per day. But in Blacks, this was accompanied by an increase in sodium excretion of 40 milliequivalents per day. Electrolyte-free water excretion also increased in both groups, but remained much lower in Blacks, 385 versus 706 milliliters per day. This suggests that despite similar treatment recommendations, the increase in fluid intake and urine volume in Blacks was associated with a higher dietary sodium intake. The limitations of our work include the retrospective nature of the study, as well as being a single-center cohort. The biological differences that lead to differences in risk factors for stone formation and differences in treatment response warrant further study.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.